Hi, my name is Dr. Charles Alessi, and I'm one of the authors of the book called Increase Your Brainability and Reduce Your Risk of Dementia. In this podcast, I want to talk to you a little about how to maintain and increase blood supply to the brain. It sounds like a very esoteric subject, but actually it isn't. And there are many things one can do to ensure that blood supply to the brain is actually maintained. So, we know what a brain looks like. We've all seen what a brain looks like, this grey mass of jelly-like substance, but it's actually full of blood vessels. And blood vessels are really very, very important, because if that blood supply is in any way interrupted or interfered with, then the possibility of us developing everything from strokes to bleeds to all sorts of problems associated with that, which includes, by the way, of course, dementias, increases. So trying to find some way of actually managing to decrease your risk of developing these problems with the arteries is a good idea. So what problems do these arteries develop? Well, in many respects, it's actually, again, really quite simple. The arteries tend to fur up as we grow older. There's this condition called atherosclerosis, and it's not that dissimilar to the furring in a kettle, where fats are deposited on the inside of the arteries. And of course, this makes them less efficient. Secondly, there's always a possibility that arteries burst, and that is certainly not a good thing, because that can cause things like strokes, bleeds on the brain. Again, this would have potentially a really quite serious effect, but even if it's only little transient ischemic, in other words, lack of blood attacks in the brain, you can then develop cognitive decline and dementia associated with that as well. And thirdly, of course, the arteries can become blocked. And there are conditions like atrial fibrillation, which actually predispose to this. And there are ways in which we can ensure that we look out for this and we manage this a little bit better. So let's talk about what we can do, because I think the whole basis of what we're trying to do is to be practical in terms of what can I do today to make a difference. So we start as usual with physical activity. It's funny, physical activity has become so much more important, even from the days when I was a medical student, when we didn't concentrate on it quite as much, but it really does make a significant difference to people's lives, both in terms of quality of life and also in terms of risk factors. Maintaining good physical activity is really important, and there are ways to maintain that physical activity even if you're bedbound, even if you're in a wheelchair. Upper body strength, there's all sorts of things you can do, and it doesn't necessarily mean that you have to wear a leotard and go to the gym. It can also mean that what you need to do is just exercise a little bit more. And I think that's really what we're talking about today, and ensure that something like walking, which is probably the easiest thing we can do, is something we do more of. The second thing is really diet. And for a couple of reasons. One, because of the fact that some diets really predispose to us becoming fatter. And we know that weight is a significant issue in conditions like type 2 diabetes, because if we increase in weight, it's more of a chance we develop these conditions as we become older. And type 2 diabetes is also associated with dementia in its own right. So why get a condition which predisposes to another? And in terms of diet, we know the diets that are good for us. We know that Mediterranean diets are particularly good for us. We know that avoiding saturated fats, avoiding processed foods are also really quite good for us. So there are things we can do. I mentioned type 2 diabetes. It's actually really important because when people tend to develop diabetes, usually in their middle ages, so, in their 50s or 60s, we didn't quite realize until recently that diabetes is a wholly preventable condition. That means you can even, if you develop this condition, cure it purely by increasing your levels of physical activity, by diet, obviously associated with that by managing your weight and by increasing your exercise. So this is really quite important. We manage our diet, we manage our physical exercise, we manage our weight. Then, of course, there is cholesterol. Lots of controversies about this condition of high cholesterol. We know that we can manage lesser degrees of high cholesterol purely just using diet, but some people need to go on medication. And medication, we also know, is particularly effective in actually managing high cholesterol. And the moment you manage your high cholesterol, you reduce your risk of developing things like strokes and heart attacks and all sorts of cardiovascular conditions, which also predispose to dementia. Smoking. Well, if there's one condition whereby there is an enormous amount of evidence around managing to reduce your risks, it's smoking. Smoking is something which, fortunately, we're seeing less of. But in many respects, it's wholly manageable. Yes, it's not that easy to give up, but there are plenty of ways now which people can take up from basically changing your routine. So, for example, if you always have a cigarette after you have your shower in the morning with your coffee, leave home after you have your shower in the morning and have your coffee at work where you can't smoke. If you usually have your cigarette after a meal, do something different after a meal. Change your habits. And in many respects, that assists you in managing smoking. But also, of course, there are things like nicotine replacement, which are available, and also medication, which is available. And it's never too late to start. Not only do you protect yourself from conditions like cancers, but you also protect yourself from heart disease and from dementia. Blood pressure. Again, really important to manage this. And of course, as we know, high blood pressure doesn't cause pain. So it's rather difficult to figure out how you got blood pressure unless you take it. So really taking your blood pressure regularly or getting your blood pressure taken regularly every couple of years is a really good idea, just to make sure that your blood pressure is normal. And if it is elevated, then, of course, seeking medical help. Again, there are many ways you can manage your blood pressure before you get to medication. We're back to physical activity. We're back to diet. We're back to weight control. But in many respects, a significant number of people just manage their blood pressure and it goes back to normal without taking medication. But if you have to take medication, of course, it's worth taking. There are many types of medication you can take. Some of them have very, very manageable side effects, if any. In many people, they get no side effects at all. The important thing, of course, is monitoring that and ensuring that you manage your blood pressure and manage your medication regularly. In other words, getting medication reviews. And finally, I talked about atrial fibrillation. What is atrial fibrillation? It's actually quite a common condition as we grow older. And in essence, it's an irregular pulse. And you can check your own pulse by actually putting your fingers over your radial artery and feeling and checking that your pulse is regular. When I say irregular, it means the beats are irregular, but also the volume is irregular. And if you notice that your pulse isn't regular, get that checked. And you can go and see a physician, go to a clinic, and they'll check your pulse just to make sure that you don't have atrial fibrillation. What it means is that the rhythm of your heart the mechanism which controls the rhythm in your heart isn't working perfectly. Now, there are some things which can actually cause that in their own right, having too much black coffee, for example, and also having thyroid disorders. But whatever the cause, it usually needs treating. And there are many ways it can be treated. People use drugs. People use something called ablation, which is burning some aberrant tissue. And people also use cardioversion, which is basically shocking the heart to get back into rhythm. But this is really quite serious, because once people get atrial fibrillation, there's a higher chance of them developing mini strokes or transient ischemic attacks. And of course, getting strokes is not a good idea, because once one starts getting strokes, there are the physical effects, which we're aware of. You lose the ability, in some cases, to move your arms and legs. It's often on one side of your body, as we know. But also it has an effect on the brain, because parts of the brain, the thinking parts of the brain, and the parts of the brain associated with memory and with cognition and with higher thinking also get damaged. And the effect, of course, is cognitive decline and dementia. So clearly we need to manage that. We all know how to figure out if somebody has a stroke. It's too good an opportunity for me not to mention that in closing today's podcast. And there's an acronym we can remember, because it's really simple to remember, and you one day will save a life in doing this. All you need to remember is FAST. So look at the face and check that somebody's face isn't lopsided, because often in a stroke, you get paralysis on one side of the face. Ask the individual to raise both arms and raise both legs, because quite often there's a unilateral. In other words, one side is paralyzed and the other side isn't. Check the speed of the individual, just to make sure that the individual can speak as well as understand. And the fourth is time. It's urgent to actually get medical help. There are clotbuster drugs we can use to give people to ensure that if there is a clot in one of the arteries in the brain, it can be dissolved, as long as they get a clotbuster quickly. So there are ways we can manage a whole host of things. And really, the message for today is, not only is it possible to maintain an increased blood supply to the brain, but actually, if we change the way we live, if we increase our physical activity, if we change our diet, if we think more about keeping ourselves healthy, I also think we'll be happier, we'll lead a more fulfilling life. So it's really up to us now. Let's go out and do what we need to do. Thank you.